This is a picture of a baby with a zinc deficiency, and you can see the tissue has been affected by the lack of zinc. The baby's very rashy and has some scabby, nasty areas. He or she does have eyes. They've just kind of blanked them out for privacy. Although I don't think you could tell whose baby this was just from looking. But you can see there's some skin problems in this baby who, for whatever reason, is deficient in zinc. So when it comes to vitamin and mineral deficiencies, you want to assess your patient. You want to look for any symptoms of diseases that could lead to their deficiencies. What medicines are they taking? Do they have any allergies? For diagnosis, think about factors that contribute to a lack of nutrition. Smoking, like we talked about, drinking alcohol can really leach the water-soluble vitamins from the body. And then something silly, even like real licorice, not like Twizzlers, the red Twizzlers, but real plant-derived licorice can interfere with potassium in the body. So people who are on potassium supplementation or have cardiac issues have to watch their licorice intake. Not everybody likes black licorice, but if you like it, eating the real thing like they sell in Europe, I mean, that's some strong stuff. It can cause some cardiac issues. All vitamin and mineral supplementation involves a certain amount of planning. Many of them require lab tests to check the levels prior to administration. And like all meds, they have to be properly stored. Not too cold, not too hot, not too much air, and avoid light. Implementation, it's very important to know the routes of administration for the vitamins that our patients are having to have. And we have to look at the therapeutic effects. Is this drug doing what it's supposed to be doing? Are they having any adverse effects from the administration of these meds, like, GI side effects? And then follow-up labs. Potassium levels definitely have to be checked if there's any question, as well as, vitamin B12 levels, lots of other vitamin levels in somebody who has an overdose or has a deficiency, to keep an eye on what they need. Folic acid, vitamin B6, and vitamin B12 are mentioned all together here because they can help prevent elevated levels of homocysteine, that amino acid that can be a risk factor in heart disease. So if you have sufficient amounts of folic acid, which is what we say, vitamin B9, and then vitamin B6 and vitamin B12, they can lead to lower levels of homocysteine, which can cause heart disease. So if you have enough of these B vitamins, that can protect your cardiac health. So for high-risk populations, it's recommended that they take a supplement that has folic acid plus B6 and B12. B12 is very hard to get into the system. You lose a lot in that first pass effect through the liver. So it's generally recommended to take B12 injections, or sometimes people have success with B12 sublingually. Put it under the tongue, it dissolves, and then it can get into the bloodstream without having to have a lot of it lost in the liver. When it comes to us as nurses, our nursing responsibilities are to ask about complementary and alternative medications, including vitamins. Over-the-counter drug use, what does your patient take in addition to the prescription drugs that we're aware of? Do they take herbal medications? Do they take things over the counter? Remember, people think that if something is freely sold at a health food store or a drugstore, that it's not dangerous, or that it can't cause any problems with drugs they're already taking. They don't realize that they have to report those too. So we have to be specific. Are you taking any medications, either prescription or something that you might buy at a health food store or at a drugstore? Sometimes medications or herbals have to be stopped 2 weeks before any kind of invasive procedure. So I know before you have a colonoscopy, you have to stop aspirin or Motrin. If a patient is going to have planned surgery, they should stop taking garlic, ginkgo, ginseng, any of those drugs that can lead to bleeding. As nurses, we should educate ourselves about what treatments are safe and effective, and that way we can advocate for our patients and study those. I've included a link to one of my very, very favorite websites. It's a blog run by several doctors and who also have PhDs at the same time, which just impresses the heck out of me, an MD with a PhD as well. And they have guest columnists too, and they write about all sorts of medical issues, and their information is science-based. So it's a nonprofit website, so nobody's making money off of it. And so you can go to www.sciencebasedmedicine.org. There's also sciencebasedpharmacy.org, and I recommend both of those as really good sources to find out about issues of the day. They have a whole section on vaccines. They have a section on safe chiropractic. They have all kinds of things about all sorts of controversial information. I haven't been there recently to see what they say about COVID-19 and all the conspiracy theories, but I'm sure they have some good information there, so I recommend it. So this is the last chapter where we will just be talking about the basics of pharmacology. Next, we'll get into our section that is officially called Medication Administration and IV Therapy, and that's where we'll be talking about the drugs themselves. So we will kind of get away from general principles, and we'll be talking about the various body systems and the medication that work for those. So that will start in the next chapter. I know this has been a long, tedious chapter with lots of sections, 15 sections. I think it's probably going to be one of the longest chapter lecture setups that I have to put on Edmodo, but I appreciate your attention if you've made it this far, and we'll move on to med administration.